I'm going to begin by reviewing my provider's orders. I want to ensure that my permit or consent form has been signed. I'm going to go ahead and enter patient's room, perform hand hygiene, provide patient privacy. Hello, I'm Marielle. I will be administering your blood today. Can you verify your name, date of birth for me? I have my MAR over here. Okay, I have Foley Ferdinand, account number 111234, medical record number 45632, date of birth is 9/23/1969. There is no allergies indicated on any of my records here. Everything is matching up, so I'm going to go ahead and explain my procedure to my patient. So like I said, this is that blood transfusion. It will take about 3 hours or so to fully transfuse. Signs and symptoms to look out for: if you're experiencing any chills, fever, rash, itching, shortness of breath, flank pain. Those are some abnormal signs we want to look out for. And if you are experiencing any of those, they want to immediately stop the infusion. Do you have any questions? Okay, I'm going to go ahead and proceed with my cardiopulmonary assessment. I'm listening for heart sounds, rate, rhythm, and then breath sounds, respiratory rate, and oxygen saturation level. As far as my neurological assessment, you verified your name, date of birth for me. You were able to verbalize. I'm going to go ahead and ask you, do you know what today is? Do you know where you're at? Do you know why you're here? And can you tell me what month it is? Okay, perfect. My patient's alert and oriented. As far as your urinary assessment, I did note that you were voiding a minimum of 30 milliliters per hour consistently over the last couple hours. Do you experience any difficulty voiding? No? Okay, we'll go ahead and proceed. So I want to note that my patient has a central line. It's a 20 gauge, and I note no erythema or any other abnormalities as far as around the insertion site. And I wasn't touching the insertion site with my bare hands. I was just kind of going around it. So now I will go ahead and get my normal saline ready. This is my sterile packaging. I'm going to open it away from me, and then I want everything locked. Okay, looks good. I have normal saline. The fluid is appropriate color. Packaging is appropriate. Expiration 10/25/2026. I don't want anything touching either end, so I will be very careful with that. This is a little slick from earlier. There we go. All right. Take this off. Okay. I'll get this on. Do want to go ahead and prime my tubing. So I would open this here. And like I said, I have used this tubing multiple times. So that's why it looks the way it does. I'm going to open that and then open down here. And I want to fully prime the tubing. I want to ensure that there is no air bubbles. And then I'm just doing that the best I can with this tubing that's already been used. So, okay, no air bubbles, looks good. Now I'm gonna come over here and throw this away. I'm gonna flush my central line, put gloves on. Unclamp my J-loop. We'll cleanse with an alcohol swab. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Flush or get out any air. Flush 10 milliliters. I'm going to aspirate. There was some blood return, so I will go ahead and flush with that 10 milliliters. And I'm going to be doing that in a pulsating motion. And then I am assessing for any infiltration, which there is none noted. Go ahead and take this off. I am going to clean once again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Allow that to dry, and then I want to go ahead and hook it up to my fluids over here. I'm going to go ahead and get it started. I want it at a low rate because I just want enough just to keep that vein open is the rate I want it going at. I'm going to assess for any infiltration. Assessment for infiltration occurs like right after I do that flush or while I'm doing it as well. and right now since I got my fluid started, and there's no infiltration noted. Okay, I have my normal saline going. I'm gonna go ahead and perform hand hygiene. I wanna ensure my patient's in a lock position, side rails up, collar and reach. Perform hand hygiene. I'm gonna walk out, I'm going to the blood bank. I'm coming back into my patient's room with the blood. I have another nurse here with me. I'm gonna perform hand hygiene, provide patient privacy, and we'll do our verifications. Can you once again verbalize your name, date of birth for me? Okay, we have Foley Ferdinand. I have the medical record number, which is money sign, account, which is 111234, wristband CHCH 6910, location RM 211-1, date of birth 9/23/1969, blood type AB positive, ordered product LPPC, unit number 0013742, antibody negative, compatible, yes, unit markers, unit type AB positive, expiration date 5/26/2025. I have the blood group and type, RH factor, cross match number, donor number, and unit number. And then as I'm going over each of those, I want to initial for each of those while I'm going over those one at a time. Okay. I'm gonna go ahead and put gloves on. Before I get this blood going, I want a baseline set of vitals. So I will go ahead and get my patient's blood pressure, heart rate, respirations, O2 saturation, temperature, and then I will stop my normal saline, and then I will close it down here as well. Take that off. Okay, we have our blood spiked. I'm gonna allow that blood to run through and fully saturate this filter. I know it's already been used before, so again, just a verbalization. I want the blood to fully soak through into that filter, and then it should start draining. I'm gonna start it at a slow rate. I opened it up down here. We can initially start it at about 50 to 75 milliliters per hour for that first 15 minutes. After that, we can go ahead and up it to about 75 to 125 milliliters per hour. I think I said hour a second ago. So it starts 50 to 75 milliliters per hour, and then after that first initial 15 minutes, I can up it to 75 to 125 milliliters per hour. So first initial 15 minutes, I'm going to be in the room with my patient, assessing, looking for those abnormal signs and symptoms such as blushing, fever, itching, rashes, difficulty breathing, or flank pain. And there's none noted during the entirety of my patient's infusion time. First 15 minutes, I'm in the room with my patient. I am reassessing my patient's vital signs every 5 minutes. And then after that initial 15, I'm going to be assessing every 15 minutes times 3. After that, I'm going to be assessing every 30 minutes until the end of the infusion is complete. Okay, so I will go ahead and let that infuse. I'm just going to go ahead and verbalize at this point that the blood is infusing. I would go ahead and get another set of vitals just to be on the safe side. That's just part of my normal assessment. So my vitals would include blood pressure, heart rate, respirations, O2 saturation, and temperature. I'm going to take my gloves off, perform hand hygiene, provide patient privacy, put patient in a low lock position, side rails up, call light and reach, and then we'll just allow this infusion to complete. So I'm going to step out of the room, come back in, my infusion is complete. I'm going to perform hand hygiene, and then I'm going to go ahead and reassess my patient. I have my gloves over here. So now that it's complete, I want to stop my blood, clamp up here, allow the normal saline to flow. Again, it's still open down here, and there was no signs of infiltration for the entirety of my infusion. Okay, as part of my assessment, cardiopulmonary, I'm going to be listening to heart sounds, rate, rhythm, breath sounds, respiratory rate, O2 levels. For my neurological assessment, can you verify your name, date of birth? Can you tell me where you're at? Can you tell me why you're here? Can you tell me the month? Okay, perfect. Urinary output. I see that you've still been maintaining that 30 milliliters per hour consistently. Have you been having any difficulty urinating? No. Vital signs. I need your blood pressure, heart rate, respiratory rate, O2 saturation, already said blood pressure, and then temperature. Okay, now we have all those. We're all normal. I don't see any abnormal signs or symptoms, like I said, like itching, rash, fever, chills, flank pain, or difficulty breathing. So I have that normal saline going right now. I want to just let it kind of prime the rest of my tubing. I want my patient to, just, they've fully gotten their blood transfusion at this point. So I'm gonna go ahead and proceed. Already assessed. So I will go ahead and close my tubing. And then I have my medications here. I'm gonna leave my J-loop unclamped. I'll undo this. Okay. And then I want my blood disposed of. It's going to be packaged properly in like a biohazard bag and then taken down to the blood bank to be disposed of properly. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I have my normal saline. I'm going to, that one touched the outside, so I'm going to throw this away and once again cleanse. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So this will be my new flush. I'm going to attach it. I'm going to, in a pulsating motion, deliver the 10 milliliters since this is my central line. Noting for any flushing, which there is none, or infiltration, sorry, which there is none. We'll take this off. I'm going to clean again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I have my heparin. I'm going to administer the prescribed 100 units, and it did not say in the rubric to do a pulsating motion, so I will not do a pulsating motion. Okay, now that I've done that, I'm gonna clamp my J-loop, undo this here. I want to dispose of these properly in the proper receptacles. My blood is going back in a like biohazard container, and it's going down to blood bank. I have my J-loop clamp. We can put a little cap here, secure to the wrist. I'm gonna take my gloves off, perform hand hygiene, ensure patients in a low lock position, side rails up, call light and reach. I wanna ensure that I am documenting my patient's intake and output. I want to document my entire, the entirety of my assessment during this process, and as well as the patient's toleration, which was well. My patient did not have any adverse reactions. If they did, I would immediately stop the infusion. I also want to